Why do teenage athletes get back pain? Surprisingly, it's a very common complaint, especially if you're a rower, cross-country skier, football player, or gymnast. It is typically a matter of overuse, and in certain sports, activities asymmetrically develop one set of muscles over the other. In rowers and in cross-country skiers, it's a very repetitive motion, and there may be asymmetric utilization of back extensor muscles over the abdominal muscles. Reduced range of motion of the hips and legs can cause extra stress on the back muscles, leading to overuse injuries. For gymnasts and football players, repetitive extension can cause more than muscle issues. Stress fractures of the pars interarticularis can occur, causing back pain, especially with that extension activity. For young athletes, disc herniations are not as common as middle-aged athletes, but there's still up to a 20 to 30% incidence of a disc finding for those under the age of 21. So whether it's an overuse muscle issue, a stress fracture to the back, or a disc herniation, steps need to be taken to identify treatments and concerns. If the athlete has wide areas of numbness, significant muscle weakness, and inability to perform important bodily functions like controlling their bladder and bowels, a visit to the emergency room is necessary to rule out very bad problems like an infection, a tumor, a broken bone, or a very large disc herniation. Usually, the athlete will not be able to play, and in this scenario, it's a rare, hidden problem. Get these athletes medical attention as soon as possible. For very motivated athletes, coaches and parents sometimes do not know there's an issue until there's a significant decline in performance. In this scenario, questions need to explore potential for the serious conditions described before. If there's no serious concerns, some activities restrictions, some use of over-the-counter anti-inflammatory agents, and some manual therapies such as ice massage will usually heal a soft tissue sprain or strain condition. If there's no improvement within a week or two, the coach, trainer, or parent should obtain a medical evaluation. At this point, the medical team will make a decision on whether to pursue more aggressive evaluations, including X-rays or possible MRI studies. X-rays can identify the spondylolysis condition. MRIs can further identify problems related to the disc or provide clues as the development of the stress fractures to the lower back. Depending on the findings, different options can be pursued. If there is a so-called spondylolysis stress fracture, immobilization in a brace, stopping playing activities, up to 6 to 9 months may also be necessary. If there's a disc herniation causing nerve irritation, activities modifications, avoiding contact sports, and giving it about 4 to 8 weeks will usually allow these to heal. Luckily, most episodes of back pain in adolescent athletes are of a soft tissue nature, and with proper restrictions and stretching and therapy, most athletes will be able to return back to full activities within 2 to 4 weeks. Remember, if there's a significant decline in performance, make sure to check and ask questions about the pains. If there's a significant complaint of uncontrolled weakness, inability to control major bodily functions, the athlete should be sent to the emergency room right away. If you'd like more information about similar topics, please subscribe to our newsletter or to our YouTube channel. Thank you.